are some ways we can help develop our healthcare system in the U.S. Well, one of the things is it is really critical that providers, physicians, and nurses are having a shortage. There is a really big shortage in the healthcare industry, believe it or not, because burnout is happening and it is real. One of the things is the ratio from patient to the provider. That is one of the really, really big things, and it's causing a lot of exhaustion. Our nurses are working longer hours. They're away from their families, and they're really, really tired mentally, emotionally, physically, spiritually, all of the different things. So making sure that we are checking on the mental health of our staff, creating these systems and these programs to be able to help filter our nurses versus our future nurses that are coming to happen, right? Number two, enhancing the cultural competence. It's a thing. We live in the U.S. We are so diverse, so many different adversities, so many different cultures that we come about from a nurse to our patients. Learning how to provide that adequate quality care, learning more of how to communicate from a provider, a nurse to our patients, effective communications. That is making sure that our healthcare systems are providing regular around the clock mandatory training that us nurses are able to get. Another one, number 3, is to improve employee morale. I don't know if you ever noticed, the nurses are down. They're tired. They're feeling underappreciated. They're overserving and underappreciated. So if our systems can start more of building on to our nurses that are at the bedside, creating more opportunities for leadership roles that people can attest to, they can start transitioning to, the more we have an incentive to go further and we don't feel stuck, the more we'll be more appreciative into what we're doing on a daily basis. That's why at an EHA, we make sure that we are providing this professional training with our individuals, our aspiring nurses, our nurses, as well as the organizations. Another one is professional and personal development. Professional and personal development. A lot of the times we're working in an environment to where we have our, we have our overachievers. We have our nurses that are into those roles to where they are not outspoken as everyone else. They're more of kind of to themselves, but then they do play a critical role. So learning how to build on character to each individual, whether they're an introvert or an extrovert with introvert tendencies, like myself, just building on those characteristics and giving them that boost. More of, a vision of where they can go, more of a vision beyond the bedside kind of thing. And lastly, just overall healthcare system quality. It would be really great to have in the U.S. free healthcare for all of us. But this is not going to happen overnight, you guys. This is an ongoing thing. So what we can do, we can build on to what we already have. More people get involved, more Medicaid, more Medicare, and be able to, once we have our over 65 population when they retire, everything's inflated in California. This is not a let's just tonight, one day overnight thing. This is an epidemic. It's ongoing. I would love to see free healthcare for our U.S. healthcare providers and individuals as well. So I am so excited to be here. Thank you guys for having me, Nurse Candy. I am excited. Let's make a difference, you guys. Let's make a difference today and tomorrow. Nurse Candy, thank you.